enjoy taking care of people to get them back to where they were. I like to intervene and help in an orthopedic. In orthopedics, we are able to do that, whether it's something as simple as a cast for a fracture or an injection, on up to minimally invasive surgery like arthroscopy or a knee or a hip replacement. We typically can get people close to or at the same level that they started at, and that's probably what really is the most gratifying about doing what I do is helping a person get to where they want to go, whether it's a work-related or whether it's an activity or a sport that they play. One of the things that's really been very gratifying about my job is about my position here at Orlando Orthopaedic Center. I perform a minimally invasive tissue-sparing anterior approach total hip replacement, and I have at this point in time I'm performing surgeon education for this. So typically I'll travel to another town or sometimes locally, and we will give a presentation to some surgeons, and then I'll perform a demonstration on anterior approach hip replacement, which has been very gratifying to help other doctors learn how to perform the anterior approach hip replacement. One of the things I enjoy the most is educating patients. I'll take a patient and I'll show them a model of their knee or their hip. I'll show them the different types of implants for a hip replacement, the different parts that we're going to use if we're planning a hip replacement or knee replacement. I will show them their MRI. I'll point out specific things on their MRI. I try to really educate as much as I can, and I try to give more than one option. I try to not just say, you know what, this is what you need. I try to say, well, we can do this, this, or this, and these are the pros and cons of each one of those treatments. So I try to give people, to the best of my ability, I try to give them a full smattering of the different types of treatment choices that they have. My wife and I have lived here in Orlando for about 3 years. I have a 11-year-old and a 5-year-old, and we really like this area. My wife has lots of relatives here to keep us company, and I enjoy all sorts of different things. I like to golf. I like to work out, and mostly do things with my children, their activities, whatever they're into. I tend to be as involved as I can. I'm from outside of Buffalo, New York, in a small town called Salamanca. It's a very robust rural area. That's where I was born and raised. My parents still live not far from there, and I ended up going to college in North Carolina, and then I went back to that area to Buffalo for medical school. And before I went to medical school, I picked up a scholarship with the United States Navy, and after completing residency in Boston and fellowship in Boston, I performed 4 years of active duty in the Navy, and I was the head of the arthroplasty department at Naval Hospital Jacksonville. And so while I was in Jacksonville, Florida, I started looking for full-time positions when I got out of the Navy. It just so happened that Orlando Orthopaedic Center was looking for someone who was specially trained in joint replacement surgery, and so I just sort of got the ball rolling and ended up moving to Orlando when I got out of the Navy, and that was in 2008. One of the things about my career that I enjoy is I do a lot of event coverage, which basically means sideline coverage. I, myself and my colleagues cover a lot of local high schools. I'm the team physician for the First Academy, which is in Southwest Orlando, and I also am a physician for the Ulner Palmer Invitational at Bay Hill, where I perform medical coverage for that event. I've been doing that for 3 years, and I also perform sidelines coverage for the LPGA Tour Championship. I chose orthopedics based on the fact that I like to help people get back to their active lifestyle. I like taking care of injuries. I was always involved with sports and myself, and just sort of gravitated towards that community. And within orthopedics, I just, for a lot of different reasons, I gravitated towards shoulder, hip, and knee.